Hi everybody, my name is Susie Tuchinski. I'm an occupational therapist and a certified driver rehabilitation specialist. As an occupational therapist, I like to look at what occupies people's time and how an injury or an illness might be getting in their way of doing what they want to do. So for a lot of people, driving is a big piece of their time and how they're able to engage and do different things that they want to do. As a specialist, I've taken advanced training and I have advanced knowledge and work in the area of driving rehab, so I understand how a medical condition could impact safety behind a wheel or while driving a car. I own my own private practice. When people come to see me, I start with an evaluation. The comprehensive driving evaluation includes a couple different parts. The first part, we sit down and I'm going to test different components that you need for driving. So I'll test vision, how you're moving, how you're coordinating your arms and legs. I take a look at sensation, and I'll do some paper and pencil activities as well as some other activities around the house to understand how you kind of think and problem solve and prioritize. Next, we go into the car. We use a driving rehab vehicle, which is an instructor vehicle adapted with an instructor brake. This is to allow for an extra layer of security. Many times if I'm seeing you after a stroke or some kind of injury or illness, it may have been months since you've been in the car. So having the vehicle with the brake is just one more level of security and safety to help keep you and others on the road safe as well. In my company, I come and meet you at your home. So when we start the driving evaluation, the first thing I'll do is have you take me to places you would normally go. So we'll go to like the grocery store, church, your favorite shopping center, coffee, whatever it might be. From there, if things are looking well, I might ask you, what would you do if this road was closed? So I can see how you do thinking on your feet as well. When we're all done, we wrap up by sitting down with at least one other family member and talking about my observations and recommendations. The complete report also goes back to your referring doctor so that your doctor can then guide the next steps, whether it be returning to driving, continuing with some training to brush up on your skills, or to learn to use adaptive equipment if you need a new piece of equipment to help you drive more safely. Or in some cases, we're talking about driving retirement. And in those situations, I'm helping you transition from the driver's seat into the passenger seat. As an occupational therapist and a specialist in driving, it's my job to look at how your skills are impacting your safety behind the wheel and to make sure that you have all the skills you need for the occupation of driving. And when it's time to transition, to help make sure that's a smooth and fair transition for you. I love partnering with drivers all across the country, as well as drivers primarily in Pennsylvania and New Jersey, and I love working with families. Please reach out with any questions. If you're interested in more information about myself or about my program, Adaptive Mobility Services, you can learn more at www.adaptivemobility.com. Hope this was helpful. Have a great day.